One of the neatest things about our IOP program is that we have dinner every night together where the therapists and nutritionists eat alongside the patients. And so that becomes a really supportive meal environment, which I think is something that does set us apart. Most of our patients transfer down from our residential and day-night program into our IOP program, but we also do accept people entering just at the IOP level. One of the unique things about our program is also that we do see people of all genders from ages 12 and up, and that the adults and adolescents are mixed into the same milieu, which creates some really unique opportunities in group therapy. Another neat aspect about our IOP program is that the structure of the program is at night, meaning that our patients are able still to have jobs and go to school, all the while still working intensely in their eating disorder recovery. One of the questions we get from patients and families a lot is, how long is this going to be? And it's in a unique individualized process. So the time in which people will spend in IOP will depend on their individual diagnosis as well as their individual progress. We also, every couple of weeks, go and take the patients out to a restaurant and do a supported meal there, which is always a really fun experience. Once a week, we also set up challenge meals with the patients in which the therapist and nutritionist and the milieu all bands together and does a challenging meal as a group. Once a week, the IOP patients will have individual therapy either with myself or two of the other therapists at IOP. So they will have an individual session lasting 15 minutes, in addition to the 2 groups a night. On a weekly basis, our IOP program is going to be 3 days, so it'll be Monday, Tuesdays, and Thursdays, and the patients will typically arrive either at 4 or 5 o'clock. We'll have a group, and then we have a supported meal, and then we have a second group. Also in there, patients will have individual therapy and individual nutritional counseling that comes with a meal plan, as well as supported meals. Our group programming changes from day to day. Mondays we have process and nutrition, whereas Tuesdays we have art therapy and skills group, and on Thursdays we have radically open dialectical behavior therapy for the night. One of the best things I think about Fairwinds is that we treat each of our patients on an individual basis, meaning that we understand that certain issues are unique to certain people, and we want to make sure that we definitely address all of those along people's treatment.